on digital, online, smartphone and tablet. This is BBC 5 Live.
First, let's go to our health correspondent, Dominic Hughes. Is at a GP surgery in Huddersfield. What kind of surgery is this one? The new gleaming one, or the more sort of old-fashioned, homelier one?
Somewhere in between, I'd say, Adrian. We're in Slaithwaite, which is a very picturesque little town nestled in the rolling hills of West Yorkshire. Now, this town, Slaithwaite, grew up in the Colne Valley, grew up around the textile industry, once a very industrial area. It has a very large older population with some quite severe health problems. This practice looks after around 500 patients. There are, I think, three full-time doctors. I'm joined by one of them, Dr. Paul Wilding, who's the GP here. Now, this surgery, Dr. Wilding, you fear is under threat. You're pretty sure it's going to close in 18 months' time. Tell me why that is.
Thank you, Dominic. I'll just clarify, we've got nearly 5,000 patients, not 500.
Sorry, did I say 500?
Three.
I meant 5,000.
That would be the
500 would be a very
job of my dreams.
little surgery.
The GP job of my dreams would be 3 GPs for 500 patients. So there's a vacancy anyway.
Sorry,
that
was my
please tell
mistake.
me. Yeah. So 5,000 patients. Yeah, we are under extreme pressure with the workload that we have now. I believe that general practice nationally is in a state of emergency. I agree entirely with everything that the British Medical Association have been saying about the state of the general practice nation. We're working far too hard with not enough resources. And on top of that, this surgery, along with 40% of surgeries nationally and nearly 60% of surgeries in Huddersfield, are facing funding cuts, of which at this time the public seem to be unaware.
So can you sort of spell out the funding cuts, the sort of impact that would have then? I mean, why would that lead to this surgery closing? Because you've got your, those 5,000 patients that you have to look after.
It would just get to a point where we haven't got enough resources to deliver a safe service that meets patients' needs. There's a real kind of house of cards kind of effect with this, that we're being asked to look at reducing our staffing count here. Well, what that does is it piles pressure on the other doctors and nurses and receptionists that are left. If we're already saying that we're in a state of crisis already, I'm saying it, the British Medical Association are saying it, how are we going to cope with a 44% budget cut?
We did, of course, ask NHS England about the situation here, and they told us this is, in fact, one of the best funded surgeries per head of population in the area.
It is one of the better. I dispute that it's the best. I think the context to this is that general practice nationally is vastly underfunded. The proportion of the NHS budget that is spent on GP services is just over 8% of the total NHS budget, compared to the best it's ever been was 11% within the last decade or so. So we don't have enough GPs, and we're not spending enough on the health service in general. We're certainly not spending enough on general practice. So to impose cuts to a distressed GP workforce nationally, in addition to that, it doesn't make any sense to me.
Adrian, I should explain, we're in the reception area of the surgery, aren't we? So that can account for some of the noises off you might be able to hear. But it's obviously quite a busy surgery you've got here. It almost closed twice before, didn't it? You've been close to the brink before.
Under previous leadership, yes. In 2003, all the doctors and nurses left. There were days when there were no doctors and nurses here. At the time, I was the medical director for the nurse-led helpline NHS Direct in this region, and I was getting incident reports onto my desk from the nurses who were taking calls from patients who'd been directed to NHS Direct looking for an appointment and going round and round in circles because there were no doctors and nurses here. That was the last time that general practice was in crisis, before the 2004 contract. And then, 2 or 3 years later, subsequently it was taken on by the state. It was nationalised, and it was run, significantly by locums at a very significant expense. It was a very expensive service. So yes, it did fail in the past.
So if that sort of apocalyptic scenario does come into play and the surgery does close, what happens to all your patients in that instance?
Well, I think what NHS England would say is that they would re-tender the service, but to me it looks like they would re-tender the service at a lower contract value. And what we're seeing nationally is a kind of emerging gaps. There aren't enough doctors out there to run surgeries. The climate is a toxic one to try and provide a safe and effective service. Private companies that run GP surgeries are exiting the market. If we look at what's happened in Brighton, for example, the risks are too high. This is a high-stakes industry, vital local public services, and when things go wrong in general practice and in clinical care, they go really wrong. You carry a lot of accountability as a partner or a leader of an organisation running a GP surgery. So what would happen is we would close in a year or 18 months. The service would be re-tendered. Goodness knows who would want to pick up what's left of the service or the funding. I would imagine, deep down there's some sort of master plan to sort of consolidate surgeries into bigger units or something. But at the end of the day, where is the provider that can provide safe and effective primary care for nearly half the funding that we're currently getting?
Because that is something that happens, isn't it? That smaller surgeries, have been combined into bigger units. Is that not... are there not some efficiencies there, better ways of working?
Well, I'd really like to see somebody who could tell me where those efficiencies are. At the end of the day, the fixed costs of a GP surgery are the staff costs, and it's doctors and nurses mainly, and reception is vital, but they're not as expensive. And you will always need a certain number of doctors and nurses. The fixed costs are the fixed costs. So yes, there's some minor efficiencies that can be made in terms of administration, practice management, telephony, etc. But there isn't some vast efficiency saving to be had here. I really don't think there is.
We've talked a bit about patients. Let's hear now from some patients, and I'm pleased to say I'm joined by Fiona Russell, June Holmes and Pat Jones, who are all patients at this surgery. Fiona, to start with, how long have you been a patient here, and if the surgery closes, what sort of impact would it have on you?
Well, I've been a patient for about 10 years at the surgery. If the practice closes, I don't know what we'll do, because I don't have any confidence in what we're hearing from NHS England and from our local MP, Jason McCartney, that this practice will be easily retendered. I mean, we've got a GP shortage at the moment in the country. There's 10% of GP posts are vacant, and what the figure that's really worrying me is that 1/3 of trainee posts are unfilled. So I think we've got an emerging crisis. I can't see where these GPs are going to come from. I think people will be distributed, or there's some plan which we know nothing about and which we haven't been consulted about to create a mega practice. And as I say, we know nothing about that.
You obviously have some concerns about the future. June, what about you? What sort of impact would it have on you and your family if the practice was to close?
Well, I've lived in this area for 50 years, and I will say I've been able to take this surgery for granted. Like everybody else in this valley, I've had ups and downs, sort of stress-related, illnesses, parents, divorce, that kind of thing, and I've just taken it for granted. I'm getting older now, I'm in my 70s, and at the moment I've got over that sort of thing of family crisis and all that. So I mainly come here for routine care, so I'm scared actually. I think, like a lot of other people in the valley, we've been able to trust the doctors here. We've had a relationship, they know us, and that is absolutely vital. From the minute you pick up the phone and say, I'd like an appointment, the receptionist, they know you, you're a person. They look at you like you've got unique health needs, you're not just a commodity. I'm scared, but I'm also very angry, because I think the NHS is affordable. Can I just say, if it was affordable after the Second World War, when austerity, it really was austerity, well, it doesn't make sense now. This surgery works for us in this community. It's small is beautiful as far as I'm concerned.
OK, Pat, let's just turn to you very briefly. Would it bother you if you had to see a different GP? Because we've talked about that relationship between the doctor and his patient.
Yeah, I think it's really important to have the consistency of the doctors in the practice. And I can't see any efficiency in having a larger practice, because as a patient you do not want to be starting from scratch when you're describing what your illness is, what your family member's illness is. I think it's very inefficient to start again with the new GP, and we're very, very fearful that if it does go to the mega practices, you've got a 1 in 50 chance of seeing the same GP. And I fear a lot of people will not have the confidence to go to such a large surgery. There are a lot of people in this area with mental health problems. There are a lot of older people sadly developing Alzheimer's, and they feel confident, they feel safe, they feel welcomed in this surgery. They know the GPs, they trust the GPs, they know they're working hard in their interest. And I fear that people will end up being denied a health service altogether.
Okay, some very real concerns then from the patients here. Pat, June and Fiona, thank you all very much. And Dr Paul Wilding, we will hear from you later on in the programme. Adrian, back to you.
Thank you, Dominic. 2010. Our health correspondent, Dominic Hughes, is still at Slaithwaite Health Centre in Huddersfield. Dominic?
Yes, Adrian, this is one of those surgeries that where the doctors here believe it will close in the next 18 months. We're in the rolling hills of West Yorkshire in the Colne Valley. This is a town that grew up around the textile industry, once a very industrial area. Now, of course, it looks very picturesque, but the impact of that industrial heritage really is that they have a very large, older population with some very serious health problems. Now, this is a practice that looks after 5,000 patients. There are 3 doctors here. One of them, Dr Paul Wilding, joins me now. So, Dr Wilding, on an average sort of surgery, what sort of issues do you have to deal with?
I have to firefight continuously for 2.5 to 3 hours. So about a quarter of our appointments in each day are held back for same-day requests, so we can provide a good level of access amongst the best, we're told. And the rest are pre-booked, and that's mainly kind of long-term conditions management, folk with diabetes, heart disease, blood pressure, etc. And the firefighting that we do is constantly trying to reprioritise work, because no matter, as you go through the day, you tick 3 or 4 tasks off or requests, and more keep getting added. And that's where the kind of stress comes from. It's constantly thinking that something that was a priority is now about 10th in the list of priorities because there are 9 other things that are more important.
You were saying when we were chatting earlier that last Friday afternoon was a particularly hairy afternoon. Just talk me through it briefly.
Well, my version of hairiness started at 10 to 2 in the afternoon. So my first patient was early, which is great. Patients, please be on time for your appointments. 10 minutes early was great. I thought, get ahead of the game. And I was still going strong at 6:45 at night. And I'm not very well at the moment. I've got a bad back. And I was wrecked for the entire weekend because of the intensity. So no matter how many patients I saw, there were more appointments being added. There was a scare in the village about a viral illness, and folk were worried. They wanted access. We provide very good levels of access here. And I didn't go home until I'd seen all the patients that wanted to be seen.
What sort of... I mean, you say you're not in the best health at the moment, and you have this threat of the surgery closing in 18 months. What sort of toll does that take on you? The work, the worry? What has that done to you?
It's been near ruinous, I would say, to my own personal physical health and at one stage mental health. It's just been overwhelming. I mean, all we're trying to do here is fight to save a vital public local health service. One that we put an awful lot into. I think this place has had the best of my years and that of my colleagues and partners. We have put our hearts and souls into turning this place around from the abject mess that it was in back in the early 2000s. And now it's going to return to that mess again. So it's devastating, it's demoralising, and I'm no wonder that the BMA have declared a state of national emergency for GPs.
If you were a young medical student just coming out of university, would you, knowing what you know now, would you go into general practice or would you look to some other area of medicine? What would your advice to be to young doctors?
Well, it's very close to home, this, because our eldest son is a first-year medical student at Manchester Medical School. I think I would try to rise above the carnage that is currently all around us, and explain that life and the universe and everything in it are like cycles. They go from one extreme to the other. And we are at a particular extreme at the moment, but balance in the universe will be restored. Medicine is a wonderful career. Being a GP in a community is overwhelmingly positive many times. Not at the moment, though. Hang on in there, junior doctors and young GPs. Help will come, and your working experience will improve.
I suppose it must help when you're faced with those pressures to keep an eye on the big picture. Dr. Paul Wilding, thank you very much so from Slaithwaite. We hand you back to the studio. Adrian.
Our health correspondent Dominic Hughes is at Slaithwaite Surgery in Huddersfield. So any of this extra 220 million going to find its way to the doctors there, Dominic?
Well, we're told by NHS England it will, but here they are very apprehensive about the future in this surgery that's in this small town on the edge of Huddersfield in the Colne Valley. This is a town that sprang up around the textile industries. It's now, as a legacy of its sort of post-industrial legacy, it has an older population with some serious health issues. So this surgery, which looks after around 5,000 patients with 3 doctors, fears it's going to close in around 18 months' time. And I'm joined by Dr. Paul Wilding. And Paul, just remind us of the background, why you think the surgery is going to close in 18 months.
Because GPs around the country are already in a state of emergency. We are working beyond our capacity at an unsustainable level and with significant risk of things going wrong. And then on top of that, 40%, that's 4 in every 10 surgeries nationally, are facing enforced funding cuts, which in this case for Slaithwaite Health Centre are not survivable, quite frankly, and it's affecting other surgeries, many other surgeries, hundreds, thousands across the country, including the big practice in Huddersfield University Health Centre.
So, as Adrian introduced us, he said that, you know, the NHS England says there will be more money coming, 200 and something million pounds heading. What's your view of that, very briefly?
Well, we've been hearing for years about all this money that's coming into general practice. And the reality is that the proportion of the NHS spend on GP services is at a historic low, and these little bits of confetti now are not going to make much difference.
OK, a fairly pessimistic view from Slaithwaite and Dr. Paul Wilding. Thank you very much for having us in your surgery this morning. Adrian, back to you.
Yes, thanks to Dr. Wilding and to Dominic Hughes, and thanks to you for your company this morning. Enjoy the rest of your Wednesday in the company now of Afternoon Edition.
Thank you.